Good day, everybody, and welcome to another Woman in White event. Today, we're going to be talking about unblocking fallopian tubes. My name is Dr. Karen. I'm working at the Microsurgery along with Dr. Gary. Gary will be joining us today, as well as Dr. Stacy. We are due to start now at 12 o'clock. I am going to allow a few minutes for people to join in. And once we've allowed for all our ladies to join in for our webinar today, we will get started. Just in the comments, if any of the ladies can let me know that they can hear us and see us, that would be great. You can just pop a little message there to say, we can hear you, we can see what's going on, just to make sure that we are on track. Thank you, Vukani, for letting me know that you can hear and see me.
Fantastic. Looks like we've got a good attendance, Karen.
Yeah, it's looking good. Start. Okay, we will start. Okay. Welcome to our webinar. Let's talk unblocking fallopian tubes via fallopian tube recanalization. Why are fallopian tubes important? What is so important about them? So fallopian tubes are very important for fertilization and early embryo transport. They are the path along which the sperm and the egg meet. The sperm will travel along the fallopian tube to the egg, which is close to the ovary. It will fertilize the egg, and then the fertilized egg becomes the embryo, and this travels back along the fallopian tube to the uterus, where it will implant. Fallopian tubes account for 25 to 30% of infertility cases. Blockages can be silent, but they do have major reproductive impact, and a fallopian tube recanalization offers you a minimally invasive solution. So what are the causes of fallopian tube blockages? So the cause that we can fix is a mucus plug. It's usually right where the fallopian tube and the uterus meet. It's what we call a proximal occlusion. But there are other causes due to infection. So if you've previously had pelvic inflammatory disease or even tuberculosis, maybe you had appendicitis when you were younger. So the appendix is actually quite close to your fallopian tube, and just these infections in the pelvis can affect your fallopian tubes. If other causes such as inflammation, this would be something like endometriosis, where you have endometrial cells inside the fallopian tube, and then trauma. So if you've previously had an ectopic pregnancy and they needed to remove the tube or tie the tube off to stop the bleeding, then this would also block your fallopian tube. What are the problems associated with blockages? So infertility is one of the biggest problems because the egg and the sperm cannot meet. It increases your risk of developing an ectopic pregnancy. So if the blockage is not complete and it's just a partial blockage, The sperm may be able to reach the egg, and then once fertilization takes place, the egg increases in size as it's developing into an embryo. And then this larger embryo is not able to get back past the partial blockage, and then this causes an ectopic pregnancy. There's also something known as a hydrosalpinx. This is a tube that's full of toxic fluid and it impairs implantation. It can cause chronic pelvic pain, and this results in a lot of emotional and psychological stress. So what are the symptoms of blocked fallopian tubes? Most of the time, ladies don't have any symptoms. But some of the possible clues that can make you think, maybe I have blocked tubes, is if you're struggling to fall pregnant. Another thing that could allude you to you having blocked tubes is if you have pelvic or abdominal pain, or if you have an abnormal vaginal discharge. How do we diagnose blocked tubes? So there's two methods that we use in South Africa. The first, which we use most commonly, is a hysterosalpingogram, or commonly known as a HSG. I know a lot of our patients have had the HSGs. So on the right here, you can see a HSG. I'm just going to show you. So the white part in the middle is the uterus that has been filled with a dye. So we've taken an X-ray of a lady's pelvis and we've filled her uterus with a dye. We can see the dye on the X-ray. And then if you follow off from the corners, you can see a long, thin white stripe here. That is a fallopian tube. It is that thin. It is a very, very delicate structure. And then it does get a little bit wider towards the end. And on the right-hand side, you can see the same, a nice thin fallopian tube. And then it gets a little bit wider towards the end. Another way of diagnosing a blocked tube is on laparoscopy. So your gynae might do a laparoscopy for you, for example, to treat endometriosis. And then while they're doing this, they would inject a dye into your fallopian tube and they would see if the dye passes along the fallopian tube. That is another way that we can diagnose blocked tubes. Okay, so I've talked about this thing called a hydrosalpinx, and one of the reasons I want to address it today is because it is an important factor in infertility. So a hydrosalpinx is a swollen fluid-filled tube, and it blocks the egg and sperm transport. And the other thing that it does is the fluid inside the hydrosalpinx leads back into the uterus. This fluid is toxic to embryos, so it prevents implantation from taking place. So if you had a hydrosalpinx on one side, but a healthy tube on the other side, your healthy tube could facilitate a normal fertilization, but when that embryo comes back into the uterus to implant, the toxic fluid from the hydrosalpinx might prevent that implantation. It reduces even IVF success rates by up to 50%. It also increases your risk of an ectopic pregnancy, and so it is vital to treat a hydrosalpinx to optimize your chances of falling pregnant. I included a picture here. I know on the previous slide I showed you how nice and thin and delicate a fallopian tube is, and on this image you can see this big swollen tube filled with, it looks white, so the big white blob on the screen, and that is a hydrosalpinx. We would like you to have those treated before we opened up your other tube. So what are the treatment options? There are medical options, but your medical options are really targeted at prevention more than treatment. So if you had any symptoms of a sexually transmitted infection, say an abnormal discharge, pain with intercourse, discomfort when passing urine, I would encourage you to go and seek medical advice. You could either go to your gynae or to your GP, and they could treat you. And by treating infections early, you can prevent scarring and blockages in your tubes. There's surgical management. Say you've had a damaged tube due to an ectopic pregnancy, a gynae can do surgery to try and repair your tube. There's assisted reproduction. So this is IVF. IVF doesn't really treat your blocked fallopian tubes. It just bypasses them. And then there's us, interventional radiology. And we offer a procedure known as a fallopian tube recanalization. So can fallopian tubes be unblocked? Absolutely. Yes, they can. So what is a fallopian tube recanalization? It's a same-day procedure. So you would come in the morning to the hospital, you'd go home that same day. And this is because it's minimally invasive. We don't need to cut anywhere. We don't need to stitch anything. And so it is a safe procedure for you to go home the same day. The way we do it is we pass a catheter. So a catheter is a long, thin plastic tube. We pass a catheter into your cervix. It then goes into your uterus. Once in your uterus, we inject a dye. The dye shows us the uterus. It also confirms that your fallopian tubes are blocked. And then we put a little guide wire. It's a soft, flexible wire, and we pass it through the fallopian tube. So we're pushing that mucus plug out of your tube. And then this clears the blockage. Our success rate of unblocking the tubes is between 70 and 90%. And then the pregnancy rate after this varies, and that's between 20 and 60%. Now, there are many reasons that the pregnancy rate varies so much, and that's because fertility is a multifactorial entity. It doesn't only rely on you having healthy fallopian tubes. You need to have healthy ovaries, healthy eggs, and healthy sperm, and a healthy uterus. But the factor that we're going to focus on today is getting you healthy fallopian tubes. I'm going to show you a quick video of us opening a tube. So I'm just going to add it. Over here, you can see in the middle is a catheter, and then going off to the side is a long, thin black thing. That is actually a wire. You'll see it's going to come back and forward, and that's a thin, flexible, soft wire that we're passing through the fallopian tube to push that mucus plug out. So once we've pushed the mucus plug out, we then inject a dye, which we can see while we're x-raying. And you can see there that the tube fills with this dye and it goes out to the side. And here is a video of a right tube being opened. So there you can see the dye goes through this lovely thin tube and then comes out at the end. And then we know that your tubes have been reopened. All right, let's continue. So how long does a fallopian tube recanalization procedure take? As I've said previously, it's a same-day procedure. We do it under sedation. I know a lot of you ladies have had a HSG, and the very first thing you ask me is, please tell me I don't have to go through that again, because it is very uncomfortable. But when we do the FTR, you are sleeping. You're fast asleep. You're not aware of us doing the procedure. You don't feel the same pain and discomfort as you did during your HSG. The procedure itself takes about a half an hour, and you'll be ready to go back to work within 3 days. So why is a fallopian tube recanalization a good option for you? It helps you to restore natural conception. This meaning that you don't need to have something like IVF to be able to fall pregnant. You can just carry on doing it the good old-fashioned way. It is a minimally invasive procedure. No incisions, no cutting, no stitches. This leads to a very quick recovery time. It is cost-effective in comparison to a IVF, and the reason being is that most medical aids in South Africa fund a fallopian tube recanalization, whereas none of them fund IVF. We at the Microsurgery have a really good team. We all work together, and we will do the motivation and the pre-authorization for you with your medical aid. You don't need to worry about any of that. And the great thing about this procedure is that it's repeatable. If we do the procedure and we open your tubes and within 6 months you're not pregnant, then we advise you to repeat your HSG to see if your tubes have blocked again. And if they have blocked again, we can repeat the procedure. We do have a few limitations and risks. So one of the limitations is distal blockages. So distal meaning far along the tube. So normally then your HSG would show a nice thin tube, but right at the end of the tube, the dye just doesn't spill out the tube. These are not good cases for us to try and fix. For distal blockages, you could actually go and see your gynae, and some gynaes can do a laparoscopy and they try and relieve the distal blockages. If you have severe adhesions in your pelvis, so adhesions are like when your tissue sticks together. So say your fallopian tube gets stuck to another structure, we're not able to overcome these adhesions by doing a recanalization. There's a risk of reocclusion. As we discussed, the risk is about 10 to 20%, but fortunately we can repeat the procedure. There are other small risks involved, like an infection, bleeding, and even a uterine perforation, but the risk of these is very little, probably less than 1%. And then we also need to consider the underlying cause of your infertility. So, for example, if you had something like a hydrosalpinx, I would say definitely treat it before we do the fallopian tube recanalization. Otherwise, the underlying cause of your infertility, the hydrosalpinx, is still going to continue to impact your ability to fall pregnant. So I just want to summarize and say that it's never too late to unblock your fallopian tubes. Tubal factor in infertility, it plays a major cause. So you need to make sure that you have healthy fallopian tubes. A hydrosalpinx in particular is harmful for natural and assisted conception. A fallopian tube recanalization is a safe, effective, and minimally invasive procedure, and it should be part of every woman's comprehensive fertility management. I am going to now add my colleagues to the stage. So we have Dr. Gary and Dr. Stacey, and we would be happy to answer any questions that have maybe popped up during the discussion. Maybe we can start with this question, Gary. Nombulelo has asked, I heard it's a risk as the tubes will have inflammation and the baby will be in the tubes.
Yeah, so I just want to thank you, Karen, for a really great talk and beautiful pictures. And some of the questions have been answered. I think it's a very good question. So the issues causes for blocked tubes, there are many causes. If infection is the cause, a previous pelvic infection, that inflammation from the infection means that the tube can't be unblocked in this way. And that there is a higher risk of the embryo implanting outside of the uterus. So that's the sort of case we wouldn't be able to do, or we would increase a risk of complication. So that's not appropriate for this procedure. And that's where you alluded to the proximal, or the tubes being blocked closer to the uterus. Those are the ones that are more likely to benefit from this procedure. I think that makes sense. Yeah. Why is it not known or common? I see public hospitals don't offer it. Yeah, so the reality is that it actually can be offered in public hospitals. It's not very expensive, but these skills are not widely available. So I had to go off and learn it, and I teach it, but it takes time to filter through. So I think it's also true that in the private sector, it's not widely available. And again, it's because the IVF developed independently. So we had this procedure, which was around 20 plus years ago, but IVF was being developed at the same time. And IVF is very, very effective in the right patients and very useful. So it kind of lay in a box of tools with the radiologist and didn't filter to the gynae, is the way I see it. But I mean, the reality is that's what's happened. So it is a bit of an uphill struggle, but I think that's why we're having these discussions, is to make it more widely known and to make it more widely available. So just to kind of address the problem rather than answer it. But a lady with 2 blocked fallopian tubes needs to go for IVF. The lady is 45. Yeah. So I think this is probably someone that's we've got to be reasonable in our expectations. A patient who's 45 has a much reduced chance of pregnancy. And IVF with donor eggs would be her best opportunity. So I don't want to, say that this is going to solve her problems. But if that isn't an opportunity, or she doesn't want donor eggs, then it's certainly worth a try, Mashford. Then my fertility specialist says not worth it to unblock my tubes. Now, that may be true or not true, just depending on the cause for the blocked tubes, Vakani. I don't want to I may well agree with that fertility specialist when I've seen the pictures, but then I may disagree because, maybe they don't know much about this procedure. I just can't tell you, but I think we would like an opportunity to to kind of contribute and give an opinion on your case, if at all possible. Can fibroids grow in fallopian tubes? Can they block them? So firstly, they can, very unusual, they can grow in fallopian tubes, but that's very rare. More likely they block them. That's a fibroid from the uterus, and that is quite a common cause of blocked tubes. And removing the fibroid or shrinking the fibroid can actually unblock the tubes. But there are obviously tube causes also for blocked tubes. Is FTR done for all the causes of blockage? No, Yolanda, it's not. We do FTR for the cause blockage where the tubes are essentially normal, but they are blocked by mucus plugs. So the anatomy is normal. The little hairs that line the sense of the tubes that transports the egg, they're not damaged. That's the case we want to do. It's not for all causes. It's for proximal obstruction, usually in anatomically normal tubes, but it does tend to be a large number of tubes. Unfortunately, the commonest cause for tube obstruction in South Africa is infection, obviously with our high HIV rate, and those ones are not appropriate for this procedure. So how long can you start trying after? Immediately. Once the tube's unblocked, the sperm can connect to the egg and you can get pregnant. So I guess as soon as it's comfortable. How much is the procedure for unblocking without medical aid? So that again depends on how you do it and where you do it. I would think it's going to be a couple of tens of thousands of rands at least, because it's done in a private hospital. You need a theatre suite and a specialist, anesthetic, and quite a few consumables. But as we mentioned, it might actually be worth joining a medical aid. Obviously, you would declare to them that you have a pre-existing condition that exclude you for a while, and then they would allow the procedure. Yolanda, what is uterine perforation? Very good question. So that's where the wall of the uterus has been breached, or there's a hole that's through the uterus, and that's not a common thing, but it can happen after instrumentation. So if a doctor puts a scope or something else into uterus, you can make a hole in it and cause perforation, but not really related to this talk.
Yeah, we have never had one.
Yeah, it's impossible for us to cause uterine perforation in this because we're using a thin little wire which is has a floppy tip and a catheter which is very soft. It just wouldn't be able to push it through a uterus. Ilse had a distal blockage, completely open, still not pregnant after 7 months of trying. Having FTR, is it worth then redoing? Very good question. So, yes, Ilse, once the procedure is done, it's obviously open at that time, but 6 months later, it could be closed again. And unfortunately, it is well known that this blockage can recur, meaning that I would suggest that another HSG would be your next step, just to determine if the tubes are in fact open or not. That mucus obviously can accumulate. Best chance of getting pregnant is within 6 months. I think after 7 months and it hasn't worked, it's worth checking if they are open again. I'm also worried that there may be another cause for infertility. If they are open, then there are many other causes for infertility. I'm sorry it hasn't worked in your case. I've done a procedure last year in June to unblock my tubes. However, become blocked again. Why? Okay, similar question. So that mucus does reaccumulate. I don't know the answer to why. I know it happens, but there is a window of opportunity immediately after the procedure. That's the best chance of getting pregnant. So we would repeat it if you would agree to that. Is it worth removing tubes if you need to IVF using donor eggs? Yes, so it wouldn't remove normal tubes, but abnormal tubes that are filled with fluid, which we call hydrosalpinx, they can, what's the word? They can also cause infertility, although it's not just the blocked tubes that are causing infertility, but the stuff in the tubes that cause infertility. So when you remove the tube with the fluid in it, fertility improves, and that's a common procedure done by fertility specialists before doing IVF. So that's standard practice. Can one know the cause of the blockage? Well, it's often speculative, but it does depend on history. I think is sometimes we just don't know. You'd have to, I guess, take a biopsy to eventually know, and that would cause infertility.
Yeah,
I don't know
it
what
is
the
something
cause.
when, if you approached us to possibly do a fallopian tube recanalization, we do take a history from you. We do a consultation to find out, have you previously had infections? Have you ever previously been pregnant? Have you had an ectopic? Have you had any surgery in your pelvis before? So we do take all of your background medical history into account. And then based on that, we would make the decision as to whether we think your cause is most likely just a mucus plug, and let's try and open it up for you.
Thank you. Vakani, I don't know the cause of them to be blocked since I didn't experience any of the symptoms, struggle to conceive. Next step to go for an HSG. Yeah, I think that's reasonable. That's the common cause for most women, is that they struggle to conceive. Then they go through a number of tests, including HSG, to find the cause of infertility, and they find that the tubes are blocked. That's unfortunately that is most women don't actually know what happened, but I can't remember. But it could well be that the tubes are blocked by this mucus.
Here's a good one. How can the mucus you mentioned that block tubes be removed without removing tubes? So these mucus plugs that we're talking about that block the tubes close to the uterus, these are the blockages that we can remove. These are ideal candidates for a fallopian tube recanalization. You don't have to remove your tubes if you have just a little mucus plug in them.
Philworth, thank you for your comments and appreciation. Yes, this is an attempt at spreading the message, and we would be very glad for any help. Anyone's got personal experience or abilities in promoting this. Obviously, we only have a few hands. We can't get around to all the patients that need this, and expanding the knowledge is definitely to the benefits of South Africa as a whole.
Kanye, to answer your question, what causes scarring of the tubes? It's usually previous infections. In South Africa, that is the most common cause of of scarring. It's due to previous infections. And then also, if you had an ectopic pregnancy, sometimes they actually have to cut your tube out to save your life, to stop you from bleeding. And that would also cause scarring of your tubes. Even if you had something like endometriosis, where it's in your fallopian tube, that could also damage your tubes. Unfortunately, we can't fix this. But your question then, would you recommend repairing instead of IVF? If you know for a fact that your tubes are scarred from previous infection or an ectopic, then I think IVF would be a better option for you. Monseng, yes, we did answer the question, but we can answer your question again. So fibroids can cause your fallopian tubes to be blocked, just depending on how big they are and where they are in the uterus. They can press on the fallopian tube and then the tube becomes blocked. We can treat the fibroids. We actually do another procedure where we embolize the uterine artery, and it makes your fibroids shrink. And then once your fibroids have gotten smaller, your fallopian tubes may then just be open, and you might not need another procedure.
Okay, so we've got a question here. In the case we're told fibroids and blocked tubes, after blocking the tubes, can you conceive without removing fibroids? So that's quite a complicated question. There's a lot to unpack there. So having fibroids and blocked tubes, the tubes may unblock after treating the fibroids. So that's kind of the opposite answer to what you are suggesting. After unblocking tubes, can you conceive without? That's also true. So it depends if the fibroids, firstly, are the cause of the infertility or the blocked tubes or both. And that's the way we figure out the answer to that complicated question is usually an MRI and or an HSG. So the MRI is a magnetic scan that allows us to see the fibroids, where they're located and what their sizes are, what likely effect of treating them would be. So that would allow planning. And then whether to do a fallopian recanalization or removing or treating the fibroids first, that would be informed by that test. So I guess anything is possible, but I think we need a stepwise approach to just figure out what the cause of the problem is and the most likely or safest way to achieve a result is. Thank you, Vukani, for appreciation. Tabejo. Can fibroid or blocked tubes affect one's menstruation process? Increase flows, which may in time affect getting pregnant. So, and I guess I'm going to unpack this a little bit. Fibroids, yes, they can affect one's menstruation. They can increase the flow usually. And affect fertility because of their impact on the womb and where the embryo would implant, the baby would implant inside the uterus. So fibroids are a cause of infertility. Fibroids can also block tubes. Then blocked tubes, no, they don't affect menstruation. They don't affect the flow, but they do affect fertility. I want to come consult. Simugile, lovely, thank you. Please make contact with us. Our email is thebestinfo@microsurgery.com. Fibroids, obviously, something we do a lot of. That's a website. But we've got information at the Microsurgery, www.themicrosurgery.com. Our phone number is above. We will send in the right direction. We will look at your previous imaging, chat to your doctors, and see if we can help. Public hospital, HST, yeah, sure. The reality is if you can get a picture of that, that'd be great. Otherwise, we do need to see it. We could also do it at the time of the procedure, but we don't want to do something blind. I'd be happy to help you get that HSG or somehow get through that process. One thing. Thank you for answering the invitation. I'm learning a lot to stay in Lesotho. I'd love to know, consult online. How much does the consultation cost? Consultation from our side is free. We only charge if we go ahead with the procedure. Coming through from Lesotho, we'd probably see you in Johannesburg and try and time that so that you can get home and be of minimal impact on your life.
We could do an initial online consultation though, before you needed to travel.
Gather everything from there. Absolutely. Yeah, no problem. Cool. I think we're winding down. I had fibroids removed last year. Best of my knowledge, tubes are not blocked. What could be the reason for me not having conceived? Well, that's speculating. I'm gonna obviously you've got doctors involved. You've got a gynae. You're looking for a second opinion. I'd be happy to give that to you, but you have to give me the benefit of some knowledge. So I don't want to kind of give you a long list of causes and then cause anxiety, but we'd be happy to see you. The issue here is, are your tubes open or not? I'm sure we can figure that out. If you don't have a picture of the HSG, yeah, we'll get an HSG. I mean, we've got to do it one way or another, and if that's a part of the procedure or before, we'll figure it out. Annie, yes, we're in Johannesburg and in Cape Town. So we have a practice in both cities.
Cool. I think that seems like we've answered all the questions.
Very well. Thank you. Thank you, everybody. And again, reaching out, you can definitely contact us on the numbers there. We're happy to answer your questions independently. You got 3 doctors at your disposal, and we'd love to do this procedure because it makes our patients happy, makes us happy.
Yep.
Thank you.
Thank you for joining, everyone. Take care.
Ciao. Bye-bye.
Goodbye.
Thank you, everyone.